Doctor, one of the questions that gets asked to me a lot as the CEO of Spinal Kinetics is, how do I determine which patients do I do a CRMA on or which ones don't I? And the easiest way I have to answer that, doctor, is that if you think the patient has a fracture, obviously you're going to order a CT. If you think the patient has a disc herniation, obviously you're going to order an MRI. Now, the only thing that tests for the non-disc ligament damage is an excessive motion study. So if you think a patient has been involved in an injury that's damaged the non-disc spinal support ligaments, you're going to test for a CRMA. It is impossible to determine how badly damaged the ligaments are that are not the disc without an excessive motion test. So when somebody says, well, how do I know which patient to test for? In my own private practice, when a patient, I thought they had a ligament injury, I tested every single patient. There was not a patient I didn't test that I thought had a ligament injury. So it's virtually impossible, again, to determine how badly damaged a patient is without an excessive motion test. Now, it's also true that patients, if let's say you have a disc herniation, well, disc herniation is a further injury to the ligaments. What I mean by that is that the force, compressive or shear force, say a person's in an auto collision. And remember, not everybody in an auto collision gets injured, right? There's lots of people in the world right now that are in auto accidents that do not get injured. But if they are injured and their spine is injured, there's only 3 injuries that they could have. There's only 2 tissues. There's just bone and connective tissue. If they didn't break their neck, but they injured their neck, then it has to be a connective tissue injury. 2 types of connective tissue, the non-disc ligaments and the disc ligaments. 220 ligaments, 23 of those are discs. Everything else is the non-disc spinal support ligaments. Spinal support ligaments, when they are basically damage the imaging biomarker, that's the definitive thing that we see imaging-wise that tells us that we have this condition, is excessive motion. The definitive thing for disc herniation is herniation on MRI. The definitive thing for fracture is fracture on X-ray or CT. It's a displacement of the bone. So when you have excessive motion, if you think you have a non-disc ligament injury, it is impossible to determine how bad without an excessive motion test. So for those people that have a spinal injury, again, it's virtually impossible to determine how bad the spinal injury is without an excessive motion test. So you say, well, geez, the person was in an auto accident. Do I test their cervical spine and their lumbar spine, or just their cervical spine? What do I test? Where do you think the patient was injured? If you think the patient's injured in both the cervical and the lumbar spine, you're going to test both areas. If you don't think, so think of it this way. Whatever you don't order, if I didn't order a CT, obviously I didn't think there was a fracture. If I didn't order an MRI, obviously I didn't think there was a herniation or damage to the disc. If I didn't order a CRMA, I didn't think there was damage to the non-disc spinal ligament support ligaments. So it's just as easy as that. What you don't test for tells everybody in the market what you think there is not. Hopefully that makes sense. Now, that upper cervical ligament injury also should be tested for, especially when you have traumatic brain injuries, because the symptoms correlate, they overlap. And the driving symptom oftentimes is the upper cervical ligament injury. So and that upper cervical ligament injury is not a disc injury. It's a non-disc spinal support ligament. So these are the most important injuries in the market today. They cause more trouble for the patients that have them, usually because the doctors that are actually treating them don't know of them and don't even work them up, one. So don't even know they're there and are treating right over the top of them and don't realize how serious they are. I mean, patients can have levels of non-disc spinal ligament injury that qualify them for spinal fusion surgery, and the doctors that are treating them have no idea that that's there. The only way you know is to test. So if you think the patient has a spinal ligament injury, you would test.